Thank you so much, Matt, and to the entire Chicago Asthma Consortium. It's my pleasure and honor to be able to present some of what we do as a nonprofit organization and the great work of our partners, which includes Mobile Care Chicago. And Matt, as you were going through my bio, it reminded me that I need to skim that bio down a bit so I can jump right into things. So let me go ahead and share my screen. Okay. So as I mentioned, FAIR, or Food Allergy Research and Education, is a national nonprofit dedicated to improving the quality of life and the quality of care of people living with food allergies. Food allergies impacts more than 33 million Americans, and as you all know quite well, food allergy is part of
Se
the
llama,
triple threat, or part of
no, el de childhood asthma es el de las
the
tres.
atopic march,
El de
which also
ahorita
includes
tiene otro
asthma.
nombre, creo que es de alergia.
Thank you. At FAIR, we have three main pillars: research, education, and advocacy. And as I head up the health equity and community engagement team, I have the pleasure of working not only with these amazing colleagues, but across our three pillars at FAIR to ensure we can expand health equity within food allergy. I also have the pleasure, and it is just such a privilege to work with a group of amazing community health workers from around the country. And I would be remiss if I didn't mention Mobile Care Chicago and FAIR's joint community health worker. That is Victoria Enciso. She's on the call today. And all of these community health workers just do such an important job and making sure that the latest in food allergy care and management, of which there's been a lot of advancements in the past year, really meets everyone. And people are met where they are with data-driven, with clinically relevant information, care, and support as it relates to managing food allergies. I also have to recognize our incredible FAIR Health Equity Advisory Council, especially because many of our distinguished members are part of the Chicago community, including our co-chair, Dr. Andrea Pappalardo of University of Illinois, Chicago, previous medical director at Mobile Care Chicago, as well as Dr. Ruchi Gupta, who leads and directs the Center for Food Allergy Asthma Research out of Northwestern University and Lurie Children's Hospital. So why I'm here today, I am going to talk about some of our latest kind of off the presses data around our community health needs assessment, really just starting the conversation with you all. It is so important that as we get insights from the community, we relay them back to various stakeholders to validate, to learn more, and then to not only help use that to improve our programming and support, but also to make greater impact and change. So at FAIR, we really started our health equity initiatives in 2020, when nationally we were just at a reckoning that health inequities do indeed dictate how well people do when it comes to various diseases and their outcomes. And we decided to begin our programming in a under-resourced community called South Ward of Newark, New Jersey, where to this day, about 1 in 4 have asthma, about 50% rely on Medicaid, where Black and Latino children are more likely to live in poverty. And at the time, there was a 1 in 3 chance of dying due to COVID-19. And given the connection between asthma and food allergy, we thought it was really important to see if we could make a difference in the outcomes of the community by doing community engagement work. And that really starts with developing strong partnerships. And so beginning of 2021, really starting in 2020, we identify a really strong community partner who did a lot of work in asthma, but then just care and support across the life journey, everything from cradle to graduation and beyond. And that partner, South Ward Promise Neighborhood, while they were well-versed in asthma and some of the outcomes that existed in the community there and the needs, food allergy wasn't talked about as much. So it really took making that connection between asthma and food allergy to start to gain some momentum with our partner. But I would say what really made the difference in our partnership were having conversations like this. And you would start to see community members who would raise their hand and say, actually, I am also impacted by food allergy, and here's how. Or here's what I rely on to address food allergy reactions, and often it not being adequate enough. And then in 2021, we followed that up with a community health needs assessment, not only to really be able to quantify the need, but also as much progress as we were making, it still really took places like the mayor's office to hear and want to get data on their constituents about the need. And so I was so proud that we went from in 2021, hearing from the mayor's office, we don't think this is an issue in our community, to doing the needs assessment, using it to build programming, working and hiring a community health worker in Newark, New Jersey. And then last year, having a joint event, educational event with the mayor's office in Newark, New Jersey. And so it just takes me back to that time in 2021 where we started and how we were able to advance through partnership, data collection, community engagement and education, and community health workers. We formalized this initiative over the past year. Now we call it our Fair Neighborhoods Initiative. And again, it really starts with community at the basis, building partnerships that are equitable in nature, developing scholarship and internship opportunities, of which two of our latest health equity interns are from and studying in the Chicagoland area. And then knowledge transfer. And at the top of that pyramid truly are our community health workers who help ensure that information just isn't kept in ivory towers, but is accessible and practical for everyone. In 2023, we formalized our work in Chicago, Illinois, along with DC, and more recently expanding to the South. And the key activities for our Fair Neighborhoods Initiative include providing community-based food allergy education and support, supporting allergy navigation and access, training stakeholders, and facilitating access to allergy-safe foods and nutrition education. We have a number of great partners around the country, but especially in Chicago. And it's really a testament of the partnership with Mobile Care Chicago and the work of the Mobile Care Chicago team and community health worker there. So here are some of the latest from the efforts in Chicago and some of the great work of Vicky. That includes over the past year engaging over 1,100 individuals, mostly from the Ward 15 and surrounding areas in Chicago, and helping to increase new food allergy patient appointments through Mobile Care Chicago. And some of the great feedback we get on behalf of Vicky and her work includes, I learned the importance of reading labels. I plan to speak to others about food allergy, so really activating the community. I learned how to properly use epinephrine, an epinephrine autoinjector, which, as you know, is life-saving and needs to happen quite quickly in an emergency situation to really be effective. So just like we did in 2021 and in 2021 with the initial needs assessment, as we've grown the program to now 6 locations, we want to understand not only how are we doing in that initial location of Newark, New Jersey, but getting a good baseline of the impact of food allergy in the communities, in the other communities. I'm going to talk a little bit broadly about the data and definitely highlight Chicago-specific insights. Overall, we surveyed 925 adults with food allergy, and then another 200 from the initial survey in Newark back in 2020. In Chicago specifically, we received survey responses from 205 participants from these 4 zip codes. So within the south side of Chicago, specifically within and around Ward 15. And for everyone who completed the survey, they received a $15 gift card electronically as an incentive. We really, of course, wanted to be intentional about who we reached. And so we wanted to make sure we had good racial and ethnic and economic diversity. In Chicago specifically, about 32% were Black, 60% were Hispanic, and our Chicago respondents had the greatest number of Hispanic participants, and that very much reflects our engagements in Chicago through working with Vicky and the team. Definitely is one of our fair neighborhoods with the greatest Hispanic population. The age of the participants, something that's quite different and unique in this data compared to other food allergy data. Oftentimes, food allergy studies are focused on children. Everyone had to, of course, be an adult to take the survey, but we did survey caregivers. But the majority of the respondents, over 80%, were adults with food allergy. And then we had quite a number of households in Chicago and really across the board with an income lower than $17,000 a year. And Chicago actually had the greatest number of households respondents with an income lower than 17,000. And then asthma and eczema, of course, being part of that atopic march, were very prevalent in across all of the locations, but especially in Chicago. Almost 40% had asthma as well, and 31% had eczema. We also want to understand access and what that looks like, access to insurance. Across all of the locations, anywhere from 30 to 47% are using Medicaid to cover their healthcare cost. Chicago had the greatest level of Medicaid respondents in this survey across all of our fair neighborhoods. And most of the locations had well over half or double the amount of respondents with using Medicaid compared to just their regional averages. In Chicago and across all of the locations, the top allergens were shellfish, peanuts, cow's milk, and tree nuts. This especially makes sense, as you probably know, because it's such a heavy adult respondent cohort, that it makes sense shellfish is one of the most common allergens. So one of the things we want to understand from the needs assessment is access to care, especially understanding who has access to an allergist, which is the specialty that is trained to really manage care and support people with food allergy. So specifically in Chicago, when we asked who diagnosed the food allergy, about 52% of the respondents said an allergist. And then if you had a lower income, and of course within the Chicago grouping, that was most prevalent, you were twice as likely to be diagnosed in emergency care. We also asked which healthcare type had you seen in the past 12 months. We see a decrease there. So in the past 12 months, about 43% in Chicago said that they saw an allergist. And while ideally everyone would be seeing an allergist every 12 months or so, everyone would have that physician diagnosis from an allergist, we definitely see lower numbers across our fair neighborhoods. What we can see based on the original data from 2020 is that our ability to provide awareness and education around the best ways to manage and to get care for food allergy, we're able to see that there are increases in the number of people seeing an allergist to manage and to diagnose their food allergy. So in this graph, you'll see that the teal bar, that's the baseline group or the original group that we surveyed back in 2021 in Newark about their food allergy. And 61% at the time said that they had an allergist that they saw in the past 12 months to manage their food allergy. When we did this survey again earlier this year, this entire needs assessment, and we went back to that original group, 86% said that they saw an allergist to manage their food allergy in the past 12 months. So increasing from 61% to 86%. Of course, just in care, generally speaking, things are much different now compared to 2021. We're no longer in the COVID-19 pandemic. So we also at the same time not only surveyed those who are part of our fair neighborhoods, but we also surveyed their neighbors or others in their community who have food allergy but haven't been part of our fair neighborhood programming. That's the purple bar. And what you can see here is that about 52% said that they had seen an allergist in the past year to manage their food allergy. So even less than 2021. So it really goes to show that there are improvements happening when it comes to not only seeing an allergist regularly and building that relationship, but also we're seeing improvements in access to epinephrine, as well as getting that proper diagnosis. Because of timing, I won't be able to go through all of the data, but definitely happy to continue the conversation post this lunch and learn, and lots more that we can do here as a community and as stakeholders in food allergy and asthma to understand the needs and address them. As I mentioned in that previous slide, we do see lower than ideal, even just prescription rates for epinephrine auto injectors. So specifically in Chicago, of those who had a physician diagnosed or healthcare diagnosed food allergy, about 54% reported that they received a prescription for epinephrine in Chicago. And then in our Fair Neighborhoods group, our initial group in Newark, that number is 89%, much higher than it was in 2020. So we're seeing that improvement in epinephrine access as well. We not only want to know the state of things, we want to know why and what are the barriers to care and to access. And so one of the questions we asked in the needs assessment was, what was the reason you hadn't seen an allergist in the past, not only year, but we also asked the past 2 years. And the top three reasons across all locations were the doctor didn't tell me I needed to see an allergist, my allergy wasn't severe enough, or I do not believe that it would be of value to someone with food allergy, to the food allergic person to see an allergist. And these were even bigger reasons amongst this group, more than cost and insurance reasons. So while those are certainly impacting access to care, a lot of it does take knowledge, awareness, and support. And it's something that our Fair Neighborhoods initiative, through our resources, our team, and our amazing community health workers, is and can address. We also want to know concerns of the community so that we can build programming to address the concerns. And from the community health needs assessment from this past year, some of the top, and really as we kind of categorize the top pain points, number one is fear of accidental consumption or accidentally ingesting an allergen. The second pain point is cost or cost of care and managing food allergy, and then lack of access. So as you may know, there's a lot of emotional and mental health burden when it comes to allergic diseases, and amongst this population, that is no different, and even exacerbated. We've seen from other research and studies we've done. Some of the top concerns or top experiences using a validated tool called the PHQ-9. We see a lot of anxiety, fear of eating, and overwhelm. And we often think about this in food allergy when it comes to children with food allergy or their caregivers. But again, we had largely adult patients taking this survey. And then I pulled this question specifically of the adults with food allergy. So food allergy is not only a disease that impacts mental health for children and their families, but also for adults as well. And I think that's something that we can think about addressing and supporting as a community even more moving forward. And then as every disease, including asthma and food allergy, family support is really important. And about 15% said in Chicago, the Chicago respondents said that their family is not understanding or supportive of their food allergy. And as Vicky and our other community health workers can attest, the education and awareness for food allergy does not stop with the patient. It's really the whole family, everyone from the direct caregiver to the grandmom or the next door neighbor that needs awareness on food allergy and the severity of it and some of the burden that I just described. Last but not least, of course, we cannot get away from the fact that food allergy is is based on food, and we eat 3 times a day, hopefully, and we put ourselves at risk when we have food allergy of that accidental exposure. But if you have food insecurity or you live in a food swamp or places where, because of systemic burdens and barriers, you do not have access to food, it can be even more difficult to access safe and healthy food. And we see that across the board. Using the hunger vital signs, about 70% across all locations are at risk for food insecurity. Many are using food banks. In Chicago, about 49% said that they went to a food bank or food pantry in the past year at least once. And many are not able to access safe foods when they're going to food banks. So that is it. I think I'm coming up right on time. I'm going to stop sharing and kick it over to Matt and team.
Awesome. Thank you, Anita. And again, if you have any questions for Anita, you can put those into the chat, and we'll make sure that we get to any questions that you have. Um, Anita, I did have one just to get started, which is that do you think that epinephrine access will change with the availability of the intranasal epinephrine now that just happened?
That's a great question, Matt. I think that currently the idea is that this nasal device will be shipped directly to home. And so we know that a lot of people either facing homelessness or insecurity when it comes to housing may be at risk for not even being able to access that medication because of the delivery of it. So at FAIR, we really work with all of the industry partners, makers to not only provide affordable medication, but accessible medication regardless of where you live, work, or play.
And I'm also curious to know, like, one of the slides that you showed sort of talked about the different reasons why someone would probably not be seeing an allergist, and that the top three are not related to cost. I guess my first question when I saw that slide was, does that affect people's ability to access epinephrine? Do they, if they're not seeing an allergist, are they still as likely to get a prescription for epinephrine, or does that somehow change that equation? And then the sort of second question that I had was also like, what factors you think are in play where a medical provider would not be advising someone to see an allergist?
Mm. So although a primary care physician provider can provide a prescription for epinephrine, we do hear anecdotally, especially depending on where you live, that they may not feel comfortable providing that prescription. Or crazy enough, we hear of people having anaphylaxis, going to an emergency room, and not leaving with an epinephrine prescription, which is just such a prime opportunity to give that. And so I think that we need more conversation and collaboration between primary care and allergy care and to really bridge that gap, the referral gap, the prescription gap, and all of the gaps across the board. And so I do think that if someone is unable to see an allergist, while especially someone with means, they may still be able to get a epinephrine prescription reliably, but someone without those means, it's going to be even more difficult. And so I also think there could be sometimes just unconscious biases at play, whether or not we're recommending an allergist or not as a next step when food allergy is suspected. So there's a lot there, but I think collaboration among specialty groups, different care centers, and patient advocacy can really help address this.
Thank you. And I know some people will probably need to jump off, so I'll just say if you could follow the link to the survey. I saw that it was put in the chat. really would appreciate your feedback, and it helps us to structure future lunch and learns. Um, Anita, I have just two more quick questions for you. I mean, the first one was about the people being 2 times as likely to be diagnosed in an ER with a food allergy. And I wonder if you see that as an indicator of anaphylaxis, that the reason that they are being diagnosed is because some, there was an emergent issue that happened, and only at that time, when someone was rushed to an ER, did someone, take the time to talk to them about food allergy or to make a formal diagnosis.
Yes, unfortunately, I think that's exactly right, Matt, is that they had some type of severe allergic reaction that caused them to go to the ER, and they got that diagnosis at the ER. We also know that there are more resources when it comes to, unfortunately, emergency care than preventative care. For instance, the CFAR team out of Northwestern, they just published a study that showed about 50% of allergists across the country, only 50% accept Medicaid. And so it's much easier, unfortunately, to go to the ER or sometimes urgent care than it can be even to an allergist. And so, yes, I think it's because of a reaction has happened, why they're getting that diagnosis in an emergency situation rather than in a more preventative care way.
And then the last question that I have is really coming back around to the beginning and the community assessment that you've done, and also the importance of like raising awareness of community voices to sort of counteract this rhetoric that you had heard that um, food allergy was not an issue in this one person's community. And I wonder if you could talk just a little bit more about like what what that meant to be able to sort of like marshal a community to demonstrate to someone that food allergy was an issue, even if they didn't believe that it was the case.
It was a really powerful moment, and I love telling that story because even beyond getting the mayor's office, the local leaders on board, so at FAIR we have National Hill Days where many organizations will go to Capitol Hill, bring advocates, and talk about their policy goals. To this day, every year since we've developed that partnership with South Ward Promise Neighborhood, they've had a team member attend and sometimes even speak and go to the Hill on our Hill days to talk about food allergy. And again, food allergy is not part of their everyday, but we're able to really, through working with trusted messengers in the community, by getting the data and elevating the community voices, we're really able to galvanize a whole community. And in turn, it creates safer spaces for everyone. So it's important, and it really centers on partnership. So in Chicago, I know this is a Chicago call, would love to just continue to build all of our partnerships in Chicago with Mobile Care Chicago and FAIR.
Yeah, and thank you, Anita. Okay, we're way over time, so I think we'll cut it off there. But um, if you want to see the upcoming lunch and learns that we have, you can go to our website and just go to events. It's on the homepage for the fall lunch and learn series. We have events all the way through November, and then we'll also have a conference that's happening in November as well. And I'll just take the time to thank Anita again for being here. Thank you so much for sharing the feedback you got from your survey. And everybody, just quickly before we leave, if you could take a moment to fill out the survey, that would be really great and would be helpful. And thank you for attending today. And we'll see you next time.
Thank you, everyone.